My first guest is Dr. Matthew Luckett, who is an orthopedic surgeon with Baptist Health. Welcome.
Thank you for having me.
All right, now I mentioned hip surgery. When I see patients, they complain of back or leg or buttocks or groin. How do you know it's hip pain, and how do you make the diagnosis?
Well, first of all, hip arthritis is no different than arthritis of any other part of the body. The main factors that we look for is where the pain is located and what your symptoms are specifically with activity. So you'd have the typical pain and stiffness symptoms, but pain is typically going to be localized to the groin. A lot of people will come in complaining of pain more in the buttock area or the back, and sometimes on the side. Pain on the side can be from the hip joint or from the back. Pain in the back is mostly probably greater than 90% of the time coming from the back. So we look for pain localized to the groin. In addition to that, we'll typically have stiffness as well, so decreased range of motion, stiffness in the morning, stiffness after prolonged periods of activity, and that'll gradually improve as you get up, get walking, and move a few steps. But typically you're going to have those same two symptoms as well as decreased range of motion, meaning you're going to find harder times tying your shoes, getting that leg up so you can tie your shoe or put your cross your legs and things like that, and that's going to be a pain generator for you.
So who's at risk? What causes hip arthritis?
Hip arthritis is multifactorial. We know there are a lot of factors that are not in our control, such as genetics that are involved. If there's a strong family history, you oftentimes have that follow through, and that be the biggest factor involved. But there are a lot of modifiable factors such as your weight, your activity level, any history of trauma, autoimmune diseases such as rheumatoid arthritis, but the biggest and probably most common factor is age. Traditionally, that age is somewhere in the 60s and 70s, but we're finding now that because of active lifestyles as well as the obesity epidemic, that people are developing symptomatic hip arthritis at a much younger age. It's oftentimes wear and tear arthritis or osteoarthritis in their 40s and 50s.
So when you see the patient, you make the diagnosis, got the symptoms, what do you do about it?
Well, you talk to them about treatment options. So your treatment options include surgery or not surgery. Most patients, want to avoid the surgery, and so we start with conservative treatment. And so that can include things like anti-inflammatories, physical therapy. Oftentimes we can talk about activities such as modified exercises, such as low or no impact exercise to keep the muscles strong, and oftentimes that'll help stabilize the hip. And the stronger the muscles are around the hip, the more of a shock absorptive effect that'll have on the hip and decrease symptoms.
Well, like you mentioned exercises, if you have hip arthritis, are there certain things that you don't want to do, or are there certain exercises that make arthritis more likely to come on?
Well, as with all arthritis, movement is good. We do know that. Medical literature says movement is good. Not moving tends to create stiff joints and less mobility. But impact type exercises such as walking, things that are repetitive jolts to the joint, are likely going to exacerbate symptoms more than things that are low or no impact exercise such as an elliptical, swimming, stationary bike, or bicycling outside in the community.
All right, so you mentioned treatment, and you did mention injections, and we see that for other joints. Do you do that in the hip or not?
We can do that in the hip. Injections in the hip, particularly steroid injections or cortisone injections, can often be done. Oftentimes those are not things that can typically be done just in the clinic because you have to do it under an image guidance such as a live x-ray view to make sure that the needle is getting into the hip joint. So oftentimes that has to be done in either a outpatient setting or sent to a radiologist to perform that procedure. But it can be done, and it oftentimes is beneficial for treatment of symptomatic arthritis.
So all that fails, they're going to be operated on. Tell me about the operation.
Well, so a hip operation can involve a number of things depending on what is the problem. Early arthritis, there are options such as a hip arthroscopy that are only done by certain specialized physicians that are well trained in hip arthroscopy to kind of clean up any abnormalities in the ball and socket joint, to shave off any bone that may be causing an impingement or something like that. There's a hip resurfacing procedure that involves basically putting a cap on the femur bone or the head, the ball part of the joint, and then a cup on the socket side to resurface that. And then finally, there's the most common that everyone's aware of, and that's the total hip replacement.
That's great information. Thanks for coming in. And if you've got hip arthritis, Dr. Luckett can help you. We'll be right back.